I'm a dermatologist who does Mohs surgery, so we specialize in the removal and treatment of skin cancer. So people come to see people who are Mohs surgeons like myself when you have a diagnosed skin cancer or something you're growing that's concerning for skin cancer. From there, we will take it, we remove it with various techniques that are necessary, all of which are the kind of state of the art at the moment. Surgery is the gold standard for skin cancer removal. The way we do it is we take a small margin around the skin cancer and then we look at it under the microscope. Under the microscope, it's all mapped out, so we can tell if there are any roots, where those roots are. And then if we need to, we go back and take those roots out, just taking a small piece of skin at a time. Once we know that it's all gone and it has about a 99% cure rate, we go back and we just stitch the wound back up, which tends to help it heal a lot faster and look much better when you stitch it up. Sometimes we can't stitch it, and that's okay. It'll still heal up well if that's the determination that's made. Part of Mohs surgery, depending on the location, sometimes we'll have to bring in fellow colleagues who are in plastic surgery, oculoplastic surgery, or ENT, ear, nose, and throat surgery to help with primarily the closure part of it. So Mohs surgery is still the best, even with large and aggressive tumors in difficult sites. But sometimes when you're in a difficult site like an eyelid margin where the eyelashes are, you'll need somebody called a plastic surgeon or an oculoplastic surgeon to come in there and repair that eyelid. The eyelid's a very delicate structure, and people train specifically just to repair and treat that area. So sometimes we'll work with them. Sometimes you do have just very large tumors, and sometimes it would be difficult, if not impossible, to close, locally with local anesthetic and just a simple session in the morning. So in that case, we might have a colleague from ENT or plastic surgery that you would see after your Mohs procedure, and they'd take you to a more proper operating room. You might have sedation, those kind of things for a larger repair. That's pretty uncommon, and we do it somewhat regularly, but most Mohs surgeries are able to be managed in the office under local, and we do both the removal and the repair on the same day. Nothing to be afraid of. Mohs surgeons, you can't even start doing Mohs surgery on your own until you do 500 cases, so Mohs surgeons are very well experienced when you get one, even right out of training.